What is the fail rate for DIEP flap reconstruction? Can you talk about that a little bit? And then, I'm interested in what's the patient satisfaction. So, are they happy, and what have you heard from your patients?
Yeah, I find DIEP flap patients are very happy. So, I mean, not everyone is a candidate. And again, like you can be happy with lots of different options. But when studies have looked at long-term quality of life and patient satisfaction, the top reconstructive option is the DIEP flap. And it just makes sense. You're replacing like with like, you're not putting anything foreign into your body that your body's recognizing as not being you, and it ages well with you, fluctuates with you, is nice and soft. So I think it's just as close as we can get to putting back in a breast, and the results kind of speak for themselves with patient satisfaction as well.
You took out gland and fat, and you replaced it with living fat. Those patients not only self-report having high satisfaction, but they have the lowest revision rate. So not only do they feel good, but their behavior fits that they're happier with the result because they're not going back for revisions and touch-ups over time. And I think that's what patients are looking for, is to heal and to move on with life and feel whole and well.
Mm-hmm. Yeah, I think I try to simplify the comparison between implants and DIEP flaps and say, the DIEP flap is a heavier investment up front because it's a longer surgery with a hospitalization, and most patients do very well. The fail rate is in the 1% to 2% range, but it's a heavy investment when you're comparing it to an implant, which is an outpatient surgery. But once you have put in that heavy investment over the course of your lifetime, the DIEP flap is aging and responding to time and gravity just like the rest of the tissues near it. So everything is just in harmony in that whole lifetime journey. So you're less likely to need revision surgery throughout the course of your lifetime. With an implant, it's a smaller investment up front, but over the course of your lifetime, as the implant responds to time and gravity and it's shifting and moving in different directions, it expands the pocket, the capsule that it's in almost everybody. That's one of the things that's almost inevitable, even if you don't have a contracture or infection or any of the other acute hard surgical indications. From an aesthetic standpoint, losing the pocket is a likely event. Some people can escape this, of course, but it's time and gravity are everywhere. So one of the common things I have patients come back for implant revisions is tightening the pocket, in addition to the other things that can happen that you might need a revision for. So smaller investment up front, but over the course of your lifetime, you're more likely to need or desire a revision of some sort.
Mm-hmm. And no implant lasts forever. So, although implants don't expire, they can flip, they can break down in the pocket or rupture, and the rupture rate is less than 1% per year. But in general, whether there's a problem with the implant, such as it breaking down, or just that the patients don't like the way it looks anymore, the pocket got too loose, or they look asymmetrical, but especially in a one-sided reconstruction, implants have a very low satisfaction rate. So when someone is planning a one-sided mastectomy, I always encourage them to consider using living tissue so that they have a breast that looks and feels and ages more like the other side.